Today, I want us to clear something. What really is severe malaria? Because in severe malaria, we need injectable drugs or anti-malaria. What is severe malaria? Now, I want you to listen to me very well. Clients and my fellow medics, this video is discussing severe malaria. Severe malaria, as long as you have a positive malaria test, be it MRDT, be it a blood smear, with the following complications. That's why whenever we are writing a diagnosis, we always say severe malaria complicated with. Now, the complication that I'm going to tell you qualifies malaria you're having to be severe. Number one, you have cerebral malaria. That means you have deep coma, anaerosible coma. 2, severe anemia. Severe anemia means your HP is less than 5 grams per deciliter, or either if you're pregnant, you're less than 70 grams per deciliter. 3, you have severe respiratory distress. You have tachypnea, you have increased intercostal recession, nasal flaring. All those can classify what we call respiratory distress. 4, you have hypoglycemia. Any of the signs, any of the complications I'm mentioning, 1 or 2 of any that I'm mentioning, qualifies your malaria to be severe. I said number 4 is hypoglycemia. 5, you have respiratory collapse. For example, you're a child and your blood pressure, your systolic blood pressure is less than 50 millimeters of mercury, and when you are an adult, your systolic is less than 80 millimeters of mercury, and you have a clinical shock. That is circulatory collapse. That's number 5. Number 6, you have renal failure. How do we know you have your renal failure? Your urine output is less than 12 mils per kg in 24 hours. Or maybe we can say another criteria we can use, plasma creatinine is greater than 3.0 milligram per dl. You have renal failure. 7, another complication is spontaneous bleeding. You have maybe epistaxis, nasal bleeding, maybe you have gum bleeding, melena, you have black stool. All those signs of spontaneous bleeding. 8, convulsions. A patient with convulsions with a positive MRDT with a blood smears result positive, severe malaria. Number 9, signs of acidosis or deep breathing. The signs of acidosis are you have deep breathing and maybe lab workout when they come out, your bicarbonate are less than 15 millimoles per liter. 10, there is what we call hemoglobinuria or darker colored urine. That is maybe the classical sign of hemoglobinuria. 11, you have pulmonary, not pulmonary embolism, pulmonary edema. You have signs of pulmonary edema, like you have signs of respiratory distress, can be signs of pulmonary edema. 12, before the workup of the following complications, before maybe we have identified, you may have what we call supporting signs, and this is my number 12. Supporting signs that a clinician can see. 1, jaundice. Your sclera is yellow of the eye. 2, you have prostration. Maybe the child has a prostration, unable to sit, yet he has been sitting, unable to drink and support himself. 3, severe vomiting. These are classical supporting signs of severe malaria, severe vomiting. The others I've discussed are complications, and they were 11. Now I'm giving you the supporting signs. Severe dehydration. Maybe it's a child and is severely dehydrated. He has sunken eyes, inability to drink, he is lethargic. Those are all signs of severe dehydration. You have hyperpyrexia. Your axillary temperature is greater than 39.5 degrees. If you're pregnant, another supporting sign, you have threatened abortion. Wow, another one, you have hyperpyrexemia, maybe by lab workout, and the parasite count are greater than 10%. If you don't have any of what I've mentioned, you don't have severe malaria. Severe malaria is complicated with 1 or more of the signs of the clinical complications I've spoken about, or either the supporting signs. Short of that, let me give you something shocking. Severe malaria, according to what I've defined for you and what I've given you, severe malaria cannot be treated on the street. If a patient is being managed from a street, has a candle on the street, in a disguise of treating malaria, it is not severe malaria, my dear. It can never be treated from a street. Our conclusion that we always make when you're making a diagnosis, you have positive malaria tests, and the end of the complications, we always say severe malaria complicated with either hypoglycemia, severe malaria complicated with either severe anemia, severe malaria complicated with respiratory distress, severe malaria complicated with dehydration. Those are the complications. And the complication is now a one that help us diagnose you.